At 14 years old, Amy El-Keria was extremely vulnerable. She had complex mental health problems and had made several attempts to take her own life. In 2012, she was admitted to the Priory hospital in East Sussex. 3 months later, she was dead.
We got to the hospital and I said, "Mummy's here, Amy, Mummy's here." And then they come in and said that there was no activity in the brain and that there was no chance of Amy surviving.
Amy's family have always believed her care was neglected at Ticehurst House Priory. More than 3 years on, an inquest jury has agreed. They ruled that staff there failed Amy during treatment and on the night she died by not dialing 999 quickly enough, not calling a doctor promptly and not being trained in CPR. They also found risk assessments were not properly carried out and staff didn't assess the risk of her being able to take her own life in her room. The findings showed the response of staff was so inadequate, the jury agreed there was a possibility Amy may have lived if she had received proper care.
This was avoidable. Amy's death was avoidable. And that's what I've said for 3.5, nearly 4 years. Her death was avoidable. If they respected her as they should have done, as the human being she was, then she'd still be here with us.
The Priory says that since Amy died, it has made major changes. It told us we undertook an extensive investigation and strengthened a number of our procedures at the hospital. We will now review the findings of the inquest very carefully and consider whether further improvements can be made. If she had lived, Amy would now be 18 years old. Tanya says she'll spend the rest of her life campaigning to make sure that other children get better care. Olivia Kinsley, 5 News.